Tennis elbow is a very common condition. The real medical term for it is lateral epicondylitis, which is a fancy name for pain on the outside of your elbow. But tennis elbow is a form of tendonitis, usually from repetitive use. What's peculiar is that 95% of the cases usually have nothing to do with tennis or any other racket sports. It's just everyday people doing repetitive things and they get the tendonitis in their elbow. Tennis elbow can present as both a sharp pain and a chronic pain. It usually gets very sharp when they try to lift something heavy. And they'll feel that sharp pain in the elbow, which can radiate into the forearm as well. But once you get it, it can sometimes be very difficult to treat. It usually lasts for months. We try to treat it conservatively initially. We do that with special elbow straps, and a lot of times you'll see people running around with these straps around their forearms. Some are just soft straps you wrap around your forearm. Some have plastic pieces and rubber pads in them. Some have little air pockets in them. All of them serve to put a little compression on the muscle and take a little bit of tension off the tendon to try and give it a chance to heal. We also try to treat it with steroid injections and anti-inflammatories, and sometimes with therapy and special stretching exercises. And we'll try to do that for several months. And most of the time that works. Every once in a while it doesn't work, and then we have to talk about the surgery to fix it. Now in the case of tennis elbow, the problem is that sometimes you get a lot of little micro tears in the tendon that just don't heal. And in order to address that surgically, we make a small incision in the elbow and we release the tendon, clean out the inflammatory tissue, and then anchor the tendon back down to the bone so that it heals as a nice solid anchor for the muscles that it's attached to. And then once you get a nice solid anchor, the pain and inflammation go away and you achieve pain freedom. After surgery, the patients are in a splint for 1 to 2 weeks, and then we start some gentle range of motion therapy. We don't really let them do any heavy lifting until 6 to 8 weeks after surgery. But once they get through the rehabilitation process, they're able to return to normal activity with significant improvement in their symptoms.